All right. Assalamu alaikum, everyone. I hope everyone is having a good morning. For those people in Pakistan, a good evening. My name is Gulrez. I am the YPC chair this year. And this will be our second session for the year where we'll be looking at alternate pathways for people to practice in US. We have a wonderful panelist. This session will be moderated by Dr. Maria Sayed. She is a rheumatology attending based in Massachusetts. But before we start, we have our current president of APPNA with us, Dr. Baba Rao, and I'll give him the mic for a few seconds.
Gee, thank you, Gulrez. When I start talking about APPNA, first thing I usually say is I have a favoritism towards YPC because they do really, really wonderful job to help doctors coming to this country and then finding ways to practice here. But this is an excellent team, starting from Rafia to Suhail to Fateh, who's my advisor, and Amir, and then Rehan. And Maria, thank you for joining. So I'll let you guys get started and just listen in. Thank you.
Thank you so much. I will pass on the moderation to Dr. Maria Sayed while I go back on my rounds. Few things is we will try to answer all the question and answers in the end. So please post them in the Q&A. Um, uh, we truly like people when they speak up. So if you can raise your hands, then host Dr. Ahmed Rayan Khan can unmute you and you can ask your question. But keep your question brief, and please just give us time to go through question and answers, and don't repeat the question answers, the common questions. And I will try my best to get the recording uploaded to YouTube. It does take a little bit time, so please be patient with it. Dr. Maria Sayed, over to you.
Thank you so much, Dr. Gulrez. So my name is Maria Saeed. I'm a rheumatologist and I'm a clinical faculty, and it is my honor to moderate this session. So it is a very hot topic nowadays that there are different licensure pathways for physicians, which are IMG, who are looking to practice in USA without bypassing the residency. So today we have like a esteemed panelist, team of panelists who have extensive knowledge on this topic. So I would like to thank you, all of our panelists, Dr. Rafia Kutab, Dr. Suhail Rao, Dr. Amir Fateh Shahzad, Dr. Ahmad Rehan, and Dr. Amir. And so, all right, before I go ahead, I would go over the house rules. All of the attendees are muted, and all the panelists are going to go over the assigned topics. Once the topics are discussed, we will open the floor for question and answers. However, in the meantime, feel free to type away your questions in the chat box, and we'll be happy to answer them once the panelists are done talking. Okay, so without further delay, I'm going to go ahead and move on to our first topic, which is going to be covered by Dr. Suhail Rao and Dr. Ahmad Rehan. This is our first and most fundamental topic, in which they are going to talk about what are the different pathways, what is the Doctors Act, and what is 2026 licensure pathway look like, and what does it look realistically. So I would like to introduce Dr. Suhail Rao, who is a transplant immunologist and infectious disease researcher based in San Antonio, Texas. He's a graduate of Dow Medical College and holds multiple leadership roles, including president and designated institutional official of the Texas Institute of Graduate Medical Education. He's president of Age-Bound Foundation and president and CEO of InvoCare Center for Research and Biotechnology. Dr. Rao has been deeply involved in medical education and innovative physician training models. Joining him is Dr. Ahmad Rehan Khan. He's medical director and addiction medicine physician at Ben Secours Community Hospital in New York. He also serves as treasurer of APPNA and president of SIMS US Alumni. So Dr. Rao and Dr. Khan, thank you for being with us. The floor is yours.
Thank you very much, Dr. Saeed. I'm going to start this particular conversation, and then my colleague, Dr. Khan, is going to join me later. My focus that has been given to me, and the topic that has been given to me is basically to talk about the provisional licensure pathway for IMGs. I'm going to focus on the Texas Doctor Act, But I'm going to also very briefly talk about some of the other states in which this has been initiated. So if you talk about the alternative pathways for clinical practice in the United States, there are two major pathways. One of them is called the bridging licensure pathway, and the other one is where there is no residency requirement. The bridging licensure pathway is only for US citizen and residents. And the pathway where there is no residency prerequisite, that the one I'm going to be focusing on and my colleague Dr. Khan will be focusing on today, which is purely for international medical graduates, but it is also for US citizens and residents who have graduated from international medical colleges. And that is the provisional licensing pathway. There is also another pathway called the limited license pathway, which is actually only for graduates of from US MD or DO schools. So for this, you have to be a US citizen. So I'm going to focus today on the provisional pathway. Now, if you look at what is going on in this particular field, this is, by the way, this is not something new. It actually started back in 2018. Many states have already enacted, but unfortunately or fortunately, it didn't come to light until very recently when many states actually implemented. Enacting it in the legislature is different than implementing it in real life. So now we have 18 states, including Texas, where I'm located, which have actually enacted this pathway. On February 1st, which is tomorrow, this pathway is actually going to become fully active, the provisional licensure pathway. It was approved in September of 2025. Texas Medical Board was given up until January 1st to actually put all the protocol in place. And February 1st, which is tomorrow, is when it's actually going to become active in Texas. It is pending in 17 additional states. And it is our understanding that it will only be a matter of months to probably a year when it's going to be actually enacted in all the states, in most of the states in the United States. Now, bear in mind that Washington State and New York already have a limited pathway previously, but they are also now going ahead with something similar to the doctor's pathway that Texas has. And then there is other 15 states where this particular pathway has been discussed in the legislature, and either it has been tabled or it has been postponed or rejected. So those are the 15 states. The understanding is that it's highly likely that they will go back to these 15 states, and something similar to the doctor's pathway is going to be implemented in these 15 states. This is just a pictorial map of United States. The one which are in orange are the ones where it has already been enacted. The one in green is where it is pending, and we are keeping a close eye on when this gets enacted in those states. As I stated, California, Washington, and New York, mostly New York and Washington, already have a limited pathway. And the gray or light blue are the ones which actually have no additional pathway at the present time. Now, as I said, there are about 18 states in which it has been enacted. And every state has its own uniqueness. And we would not have the time today to go in each and every state. So we're going to focus on Texas. But I want to share with you the core requirements, which are practically in every state and every legislature that has been passed in those 18 states. The first is that you must have a medical degree from a recognized international medical school. And since PMDC in Pakistan is recognized, any medical school in Pakistan that is recognized by PMDC is okay for this. Number two is that you must have a foreign license in good standing. Extremely important that if you are in Pakistan and your license has lapsed, you actually go and get your license renewed. You must have postgraduate training or practice experience abroad. in your discipline. So you can't be a primary care physician in Pakistan and come and want to do orthopedics in the United States. That's not going to happen. So it must be in your discipline. You must be very proficient in English. That is in Texas, not in every state. In Texas, you have to actually take an English proficiency test, QET, which we will may talk about later. You must have a US work authorization, which is important. But bear in mind that you cannot work on a J1 visa under this particular pathway, because this is not a training pathway. J1s are for training. So in all likelihood, you will actually be looking at an H1B or something similar, which would allow you to actually work in the United States. And my colleagues are going to actually address this later on. You must have a job offer from a qualifying healthcare employer. Qualifying healthcare employer is extremely important. These are entities which actually have either an existing ACGME approved residency programs, or they are affiliated with organizations that have ACGME approved residency programs. So you cannot just ask anyone and everyone to actually sponsor you or give you a job offer. It has to be very specific requirements. Now, this is again only true for Texas, but also for some other state, but it is not unique for all the 18 states in the United States. And the last is that you must have a supervised practice period before you are actually afforded a full licensure. Now, these requirements, 7 or 8 requirements, are more or less for all the 18 states. And I will tell you why I think the other states are actually going to follow Texas in a minute, because Texas has done something unique, which actually is worth discussing. So I'm now going to focus on more on the provisional licensure pathway in Texas. So the first thing is to qualify, you have to be an international medical graduate. We have already talked about it. You must have a foreign experience. And this is a little bit of this is important because you must have, so let us say that you are actually want to go into internal medicine. Internal medicine residency in the United States is 3 years. Texas law requires that you actually have a foreign experience at a minimum of 3 years post-graduation in the discipline of your choice. So, and I will tell you why they actually implemented this particular rule. So a minimum of 3 years. And obviously, you must have a license. You are required to pass USMLE Step 1 and 2. And there are very strict requirements, by the way, of how many times you can take Step 1, how many times you can take Step 2, and what should be the total amount of time that you have to spend in taking your Step 1, 2, and 3. We do not have the time to go into it, but some of my colleagues will actually go into that particular detail. You are required to have an ECFMG certification. This is only for renewal after the first 2 years, and there is a very good reason for that. Your initial practice location, as I mentioned previously, has to be restricted to institutions that have ACGME approved or accredited residencies, or organizations that are affiliated with the institutes that have ACGME accredited residencies. Your renewal has to be, there is no if, and, or but, it has to be in a health professional shortage area or rural area, which is HPSA. Now, when you, in your second practice, which is the year 3 of your licensure, that particular practice does not have to be associated with an ACGME residency program. Country restrictions, yes. There are some countries from which you have graduated, although you might be in the United States, but you cannot apply for this pathway. And you have to go into a DNI annual threat assessment. Fortunately, Pakistan is not actually in that particular list, so we are okay. Licensure duration, as I said, there are about 2 years, the initial license, and then you go for a renewal. A renewal is only once, and so the total maximum period is 4 years. Although there are certain provisions in which it could be 3 years, where you do 2 years of initial and 1 year of rural. Path to full licensure, you must pass all USMLE steps. And throughout the 3 or 4 years that you're practicing in United States, under supervision, you must be in good standing. In some states, it is required that if you are in this licensure pathway, that the patient are notified that the physician who is actually treating you or taking care of you, or a care provider, is actually in this particular pathway. In Texas, this has not been specified. And most likely, as this program matures, it's not going to be required, because it actually breaks the trust between the provider and the patient. In some states, the supervisor have to have a separate liability, because they are supervising what is called a physician who has not been trained in the United States. But at the moment, it is not specified in Texas, and there is a general consensus that it may not be required, because the institution and the physician is going to be covered by the institutional liability. Now, here is the difference that is absolutely unique in Texas. It has not happened in any other state. The Texas Medical Board has actually negotiated with the American Board of Medical Specialties, allowing individuals who have obtained full licensure and are in good standing to actually be board certified or board eligible. So they can actually take the boards. Now, this has not happened in the 17 of the 18 other states. And this is the reason why Texas is actually following the guidelines of ACGME. Same years of practice, have an ECFNG certification, pass your step 1, 2, and 3 in a prescribed period of time. So I think with all these specific actions that have been taken by the Texas Medical Board, it has really created an opportunity for physicians coming from Pakistan or from any other part of the world, from eligible part of the world, to actually go for their board certification. And the visa requirement, I have already mentioned this. You have to be either a US citizen or resident, or you have to have an H-1B visa. Now, remember, this particular program is not based on your nationality. It's based on the country where you have done your residency. So there are a lot of residents and citizens of the United States who have gone to Pakistan and have gotten their MBBS from there, though they will be also allowable to do. Now, I will take you very briefly through the pathway for obtaining a provisional license, from provisional license to full license. And again, this is unique to Texas Doctors Act, but this is more or less applicable to many other states. So first, you have to have an active license. You have to have postgraduate training. Again, as I said, for Texas, for the same period for which you are actually, the residency is approved in the United States. Yes, then you can actually go ahead. No, then if it is no, you are not eligible. Yes, you secure employment from qualified sites. This is extremely important. Please don't just randomly start calling people for employment, because you have to have an ACGME accredited residency. Obtain a work visa. That's going to be issued by your employer. Submit application to Texas Medical Board along with fees. So these are substantial fees for this. It's about roughly close to a little over $2,000 is currently the fees for this particular, to get the application being processed. Once you submit the application, the Texas Medical Board, while it is reviewing your application, is going to issue you a code so that you can go and take the Texas jurisprudence evaluation, and you complete your background check. Texas approves it if everything goes well for your 2-year provisional license. During the process of your 2-year provisional license, you have to obtain ECFMG certificate. You apply for the renewal to the Texas Medical Board, and you relocate to a rural or HPSA area. You work for 1 or 2 years. As I said, the maximum is 4 years, but you can actually finish it in 3. You pass your USMLE step 3, and you then apply for your full license to the Texas Medical Board. So this is the algorithm that you have to follow. It has been simplified. It is not as simple as I am actually presenting it to you. I think the 2 areas which are going to be very important is to secure your employment. And one of my colleagues is actually going to expand on that. And the next is to obtain a work visa. And again, my valued colleague is going to expand on that. Now, securing employment is going to be very important. And as I said, you can actually go to your network, organizations like APPNA, their national and local chapters. And one of my recommendation is that they start to curate a list. The same is true for all the Pakistani medical alumni associations that like Dugana and others. They should also start to curate their list because they have a very good knowledge of who their members are, where they are located, and are they in sites which would actually approve are ACGM accredited. There are some healthcare recruitment resources, and I can tell you that I've already received after my last webinar 2 recruitment resources, one in Houston, one in Dallas, who wants to actually help Pakistani physicians to come to United States. Obviously, you can go to the hospital system, which has an ACGME programs, recruitment agencies and placement services, and lastly, obviously, online job boards and platform. I feel that the one which is going to be most useful and most productive is going to be APPNA, their national local chapters, and also other Pakistani Medical Alumni Association. I leave you with this unfortunate change in events that happened 3 days ago, where the Texas governor had a directive where they had frozen the issuance of H-1B visa from any institution that is public, which means public universities, public research institutes, public hospitals. They will not be able to issue an H-1B visa, a new visa. Now, there is some debate going on in Texas whether does this apply to renewal. The very fact that the Texas Workforce Commission has asked each and every public institution in Texas to provide them a list of all the individuals who are on H-1B visa gives a lot of people a reason to pause and think that there is something else that's going to be happening. But this is not an absolute freeze, because if an institution does require a foreign physician, they can actually write to the Texas Workforce Commission and get a waiver. But this is something that was new. It is actually going to be up until May 31st, 2027. And I think some of my colleagues are actually going to discuss it. I'm going to stop here, and I would like to thank everyone for their participation in this part of the webinar.
Thank you so much, Dr. Rao. So we'll move on to Dr. Ahmed Khan.
Thanks a lot. Thanks a lot, Dr. Rao. I think Dr. Rao has explained our part really well. I would just like to add a few things. So, of course, this has been going on for some time now. So there were few important landmarks in this alternate pathways. One of them was there was an advisory committee on additional licensing models that was formed in December 2023. So FSMB, Intel, and ACGME joined actually hands. We have had FSMB President Dr. Humayun Chaudhry, we usually go by Hank Chaudhry, joined our APPNA events, YPC events sometimes. And we do have in pipeline that to ask him more questions about these pathways. We will also request him to do a webinar with us. So that is something that has happened, and these advisory commission, they have met a few times and they have shared some updates. I'll tell you a few quick things. As Dr. Rao mentioned, more or less all of the states are going to follow the same pattern. That is that there will be core requirements that will be non-negotiable. ECFMG certification is one of them. And the reason I'm saying is recently North Carolina passed a similar uh, law, and some people took the wording out of context and they started sharing that, oh, you don't need USMLE to practice in US. That was absolutely wrong. They did mention their wordings were different. So you have to understand this thing that a lot of people, I know that a lot of people ask us, all of our panelists, this question: can I do anything as a doctor in US without USMLE? So I would say the chances would be very slim to none. So USMLE is something, ECFME certification is that you have to do. That is. Now the second part of it, and of course Dr. Fatih Shahzad will be talking more about the visa. Most of these positions would not sponsor visa or would sponsor them in very limited quantities. So that is also something. So that would be mostly helpful for people who do not require visa, who have an EAD, H4J2 EAD, green card, or US citizenship. Um, these are some of the most important things I would like. So I know. So there was someone. NYC HHC is a set of hospitals in New York State, New York City. One of their recruiters reached out to me, and he asked me, because New York has been offering that house physician position for some time now, and that position pays you around 70 to $90,000. And they are actually very flexible. They're not even looking for like experience in Pakistan. So if you are ECFME certified, you have a US citizenship or any permit to work. So I did recommend some people to him. Some states would be more flexible, and it is all, at the end of the day, it's supply versus demand. Of course, in New York State, there are so many people, so they require a lot of people to take care of the patients. So that would, I would just summarize with that. So there's I would share the link of, there's a document which is present on FSMB website. It talks about the same things Dr. Rao talked about, the states that have enacted, the states in which the legislation is ongoing. So I will share the link of that PDF document in the chat, you guys can all review that. Thanks a lot, and we'll be here for the questions and answers.
Thank you so much, Dr. Khan. That was really insightful. I'm going to go ahead and move forward to our next topic. Our next panelist is Dr. Mohammad Fateh Shahzad. He's a graduate of King Edward Medical University and is trained in internal medicine. He's currently affiliated with Ephraim McDowell Health in Danville, Kentucky. He serves as member Board of Trustees Kemkhana USA. He is also Chair Kemkhana Foundation Pakistan, and he is Visa Liaison APPNA. Dr. Shahzad has extensive experience in advising IMGs on visa processing and regulatory considerations. So, Dr. Shahzad, continuing on our discussion about these visa implications and the employer sponsorship realities. So, what is and what is not legally possible under these alternative licensure models?
Ji, Assalamu alaikum. Thank you for arranging this very important webinar and timely webinar. My topic, I guess, is the most difficult one because of so many limitations, so many annotations, so many presidential orders, gubernatorial orders. So every day things are changing, but I will briefly go, and there's no guarantee these things will apply next month or next year because things are changing. So this is as of today. So be rest assured that I will keep updated. I'll keep updating everybody, but things are changing very rapidly. Because this new alternate pathway is going to be sponsored by your employer. In certain cases, you can work in other capacity without having an employer, but this alternate pathway is going to have an employer. So 3 visa will work. Of course, if you have a green card or citizenship or other employment authorization, you do not need any visa for this alternate physician pathway. But if you are foreign resident or national and you are living either in Pakistan or other country or even USA, you will require either H-1B visa or O visa or EB visa, and we will go detail step by step. H1 is employer sponsor visa, means it's dual intention immigrant and non-immigrant intention can lead to green card. but it has to have an employer. Like you are going to find an employer, your employer will file your petition. Before they file petition, they have to have a labor certification from the Labor Department, which is a lengthy process. They have to apply to the Department of Labor, and then there is a approval notice. Then approval notice need to be posted the site of work, wherever office, hospital, clinic, that has to stay there for 10 days. And the employer will ensure Department of Labor that this is not going to affect any US citizen or green card rights or employment rights, as well as he or she will offer salary which is equivalent to the prevail wages, and there will be contract written, and there will be detail of the job hours, benefits, all the detail. So once labor certification is obtained, then there is I-129 filed by employer with the USCIS along with the labor certification, and it can take 6 to 11 months if it's done without premium processing. But if we do premium processing, which has a $2,810 extra fee, it can be done with 15 days. Does not mean it will get approved, but it can be, the decision is made within 15 days. Once I-129 is approved, the approval notice goes to the petitioner, which is your employer, and then you receive it as an employee. You file DS-160, which is visa application form, and you go for visa interview. If you're granted visa, then you can come and work on H-1. Now, there are limitations these days. There are a requirement for fee, $100,000. The employer has to pay. So that will be a big hurdle in this H-1B visa. Now, if you are within United States, there are some exemptions that if you are going to work for non-for-profit hospital, university, or research organization of the government, you might be given a waiver for this $100,000. Or if you're on J1 research or on J2 as a spouse or a dependent, or on F1, F2 visa, and you are going to do change in category within USA, then you might be exempted from $100,000 fee. So how to do that? You are going to file a I-539. Again, the process is long, but if you do premium processing with the additional $2,800, the decision comes within 15 days, and your status is changed from J1, J2, B1, goes down to H1, and then you don't have to pay $100,000 fee and you can work. So these are H1 visa, their exemptions as well as requirement. Duration is for 3 years, and you can have additional 3 years if you apply for immigration, which is possible with H1. Immigration, I mean, is green card. Then you can get additional 1 year once you apply for immigration. Now, if you complete 6 years, you have to leave the country, stay on your home country for 1 year, then your cycle starts again, 6-year cycle. You can bring your dependent, your spouse, your children who are unmarried and under 21 age with you, but they will not be allowed to work unless they require or they acquire employment authorization. So this is about H1. We'll go in detail about H1 other things in the question answer session. Next visa you can work or which may employ in this category or in other category is going to be O1, which is extraordinary visa. Now, difference between H1 and O1 is going to be it does not require labor certification, does not require all those initial steps. So your employer is going to file a petition I-129. Once approved, if you are in the country, you will get change in category, like same thing, J1, J2, or any other category. Or if you have EAD, F1 visa, F2 visa. But if you are outside USA, you are going to apply for the visa application, go through interview, and then come on O1 visa. O1 is, although it's simple, but it has a requirement. It's extraordinary ability. Either you have received high award like Academy Award, anything, Nobel Prize, or some kind of very high position, or award, or you are a member of a national, international organization, you have published material, you have authored books, or you have original contribution, or you're at high salary position outside USA. It also involved the movies as well as TV, but I'm not going to talk about that. For physician, you have to have 3 out of 10 criteria, which I mentioned, either awards or membership or published material, original contribution, high salary. So whoever is going to file for your O1 immigration attorney will have to provide all this information along with I-129 for approval. Now, other difference is that its duration is only 3 years. You can bring your dependents with you, which is children less than 21, unmarried, and spouse. They will not be allowed to work. You cannot apply for immigration or green card based on O1, but you can do EB1, which is also extra employment visa, and then you can get green card. So that's the difference. Third visa, EB1, which is also extraordinary. The difference between O1 and EB1, which is actually 3 types, EB1, EB2, EB3, is EB1 is immigrant visa. That means your petition is for green card. It's not for visa. So you can do within USA if you are on J1 clinical research, or you're on F1, or you're on J2 being a dependent, or while you are in another country. So your employer, again, EB1, which is very difficult to get, very strict criteria. This is for mostly for people, high achievers. Does not even require a employer. You can do yourself. You don't need a contract. You don't need employer. You don't need labor certification. You are going to be your own petitioner. But EB2, EB3, you need a employment, a contract. You need a employer. Most of us will file in EB2 category, which is also most of the J1 waiver get on the national interest waiver. So requirement for these are again similar to O1. High achievers, processing is through attorney, but this is going to be a different petition. It's immigrant petition, so it's going to be I-140, which is green card. So processing time is variable. Premium processing is available with extra cost. Once USCIS approves, you have to be interviewed. If you're within USA, still you need to be interviewed, fingerprinted, your picture taken, for background check, and medical exam. If you're outside US, you file immigrant visa application, which is DS-260. Go for interview. Before interview, you go through medical exam, like any other green card applicant, fingerprinting, all that. It's expensive process, but it's doable. I will stop here.
Thank you so much, Dr. Shazad. That was really informative, and thank you for your time. I'm going to go ahead and move on to our next panelist, Dr. Rafia Kutab. She's a graduate of Fatma Jinnah Medical University. She's director of Rutland Family Health Center in Holden, Mass. She also serves on the American Medical Association Standing Committee, the AMA Advocacy and Policy Making Committee, and she's currently chair liaison committee APPNA. She was also awarded as recipient of 2025 APPNA Appreciation Award for Outstanding Leadership. So, Dr. Kutab, question for you is, what are the long-term risks and strategic planning for IMGs who are looking into these pathways?
Assalamu alaikum, Maria, and assalamu alaikum, everyone. Thanks, Maria, bringing all us together to discuss this very crucial issue. And this will help a lot of people. It's a big promise. It looks like everyone is getting very excited about it, but they are still very, there are gray areas, and it is not being tested for a long time, So still kind of mind-boggling, kind of brainstorming. Every time there is something changed, something coming up new, and that will bring you back to that, where you started. So that's how it looks like right now. I, try to explore when you reach out to me, I try to explore different sites, legislative side, board side, and including AMA, and I was able to get some facts out of it, which I will try to describe. But if you ask me truthfully right now, if we talk about the long term kind of, there is no predictability. There are risks related to that. But at least there is a one step forward, to the major, background of is that, to mitigate the shortage, especially in the underserved area. I'm a physician in an underserved area. I'm a primary care, and I see all the time, and it is those vulnerable communities, they need doctors. And I think this is a very good initiative, but it's a long way, to go. So I will share some slides. Just bear this with me. I'm not very computer savvy, but let me go into that. Okay. And then, okay. Okay, so I got in. So, as we already talking about this, there is a shortage of physicians in US. And I already said that to mitigate this issue, we need more IMGs. And there are states who are, kind of, trying to embrace this non-traditional way to get to mitigate this issue, which is really, really commendable, that they want to help their communities. But these non-traditional pathway make possible for also the IMTs, the international medical graduates or trainee, to obtain licensure by removing the requirement to complete residency in a US residency program. This is a multi-layered process. Everyone has to understand that this is not that simple. It is a multi-layered process. It includes understanding of different pathways, as every state has its own policies and requirements, long-term strategy, long-term career planning, interstate mobility and regulation, legal issues and risk. As we all know that, give me 1 second. Yes. So understanding these pathways are very, very important. Recently I went to Pakistan. Everyone was asking me. I went to my college, Fatma Janat. Students were asking me. They were very excited, but they are getting knowledge from here and there. And I'm very, very happy that, APPNA and through you and all other people, we are trying to give them this kind of, awareness that it is a multi-layered complex process and it's not going to happen overnight. Already previous speakers, they have explained the process, the requirement, but the bullet is that, like a point is that the ECFMG certification, 3 to 5 years of clinical experience, maybe 2 to 3 years, proof of a good standing in the home country, a job offer from a qualified employer, model to follow before transitioning to full unrestricted licensure, 1 to 3 year provisional or limited license after working under supervision by a US physician before transitioning to full unrestricted license. So these are the bullet points in that. Going to the long-term strategy, that's very difficult because it is untested. It is kind of, I don't want to say utopian, but kind of, everyone trying to get help for their states, the legislative level, the board level, policymakers and all that. But the core is this, it's very complex. So my advice would be to the ITPs is that target the pathways, like aim for ECMG certification, which is needed for the IMG. Maybe explore associate physician roles in US, like for the US grads, if they did not match, they did not find stuff, so they can go through the associate physician roles. Research the state laws. That is very, very important. Try to identify states with active alternate pathways, so do research on that. Secure employment. This would be, as Dr. Shazad was saying, this would be very, very important that you secure an employment and you are eligible for that. That institute is eligible and the employer is too. So that is very, very important. And then plan for provisional licensure, like always expect or prepare for an initial period of supervision, that there is none, that I don't think so anyone will let you work without any supervision. So people think that we can start working on our own. I don't think so. That would be happening very soon. Long-term planning, including career and family. This is very, very important. You know, we are coming from other countries and we just get excited about things, but family is very important. So these pathways seem exciting, but working through these pathways may limit long-term professional handovers. Mostly states who are dealing with the shortage of the primary care, and they are in like and behavioral medicine, there are no other subspecialties. So all these IMTs have to understand that these are the major area, and especially I keep on saying this, underserved areas, you know, so that's one thing. And then there can be difficulties to get board certification, specialty board certification without GME accredited residencies. It will be not possible to get the board certified. Difficulties to be transitioned into leadership roles, and also, you know, that can be also an issue to arise. Difficulty making family future plans to settle their, you know, close to their family, if there are the family members are living in another state and that state is not, you know, pathway friendly. And then, you know, for their kids' education in the future, reference for better education and stuff, so there will be, you know, some limitations in that too. Interstate mobility issues. Mobility between states is questionable also, and there is a policy of being like a stuck in state kind of situation. Lack of transferability, like, you know, mobility is limited because each state has its own non-uniform requirement for ITPs. A provisional license obtained via a new pathways in one state does not automatically allow practice in another state. So we have to be very clear about it. Interstate medical licensure compact, you know, IMLC. The IMLC you know, streamlined licensure for doctors already holding a full unrestricted license. However, ITP with provisional or limited licenses usually cannot use the IMLC until they fully convert to an unrestricted license, a process that can take 1 to 3 years or more. So the last is like legal and regulatory risks. This is very, very important. We all have to accept one thing. We are international medical graduates. And we usually don't get career counseling in our institute. And when we matched and stuff, and we don't understand the policies of that institutes. So this is very, very important to understand that. The risk of rapid alteration and cancellation for these new pathways in next few years is not very high, but it can happen. More states are facing shortage of physicians and physician burnout following such measures. By joining the trend, these states will recover that. You know, they will be able to mitigate that. It is difficult to predict the long-term legal and regulatory aspect of these pathways, but there will be still several risks for practitioner under these pathways. And those risks are, number one, supervision and regulations. Supervision, provisional licensees require strict supervision, difficult in finding employers. Employment risk, these are very important. If a supervisor leaves or employer goes out of business, the physician license may be at risk and will be not completed the required time to achieve even the restricted license. Malpractice insurance, this is big. Many refuses to cover the physician license under these pathways. They need board certified physicians, the malpractice insurances. Immigration constraints, as Dr. Shahzad was saying. State licensure does not provide visas. It will be the responsibility of the ITPs to secure work authorization like H-1B or O-1 visas, which can be difficult without an accredited residency. Risk of discrimination with lack of much advocacy by the employer. There is data which revealed ITPs are more vulnerable to complaints than others, you know. So that's very, very important. Then employers and insurance acceptance. There are concerns from entities like, ABMS that these physicians might face disparities in compensation, limited employment opportunities, and difficulties obtaining malpractice insurance compared to traditionally trained physicians, which could necessitate future adjustments. Because right now so many boards, because boards have to implement these policies, and boards are struggling with this, that how these physicians will get the malpractice insurance, or insurances are refusing to reimburse them. Then state-specific variabilities. Laws vary by state, leading to potential issue if a physician wishes to move to a state without an equivalent pathway, as we talked before. Implementation hurdles, as I'm saying that medical boards and healthcare facilities are still navigating the implementation. And initial research show how the numbers are so low of the physician entering these pathways, indicating, and that indicates that potential need for refinement in the laws to be truly effective. Because I feel this way, that on once it's a contradictory, one time we are trying to have these pathways, and on the parallel to it we are getting so tough on these visa and ban system and all that stuff. So there is a contradictory kind of tug between these two goals. And in summary, many medical organizations feel while the existence of these pathways seems stable for now and is expanding, the specific regulation and long-term career implication, board certification, full integration into the US healthcare system are still evolving. And they will be kind of changing and evolving, and we have to, take the ownership into that to bring that awareness and updating our ITPs into that. And the last is that 2026 ECFNG pathways update is that there is now OET, which is the occupational English test, and which will be, with the clinical skills and, is in place right now. So this is what I have to say about this. And, it is still a far-fetched thing, but it looks like that, we are taking some initiatives there. So let's hope for the best. And thanks for giving me the chance to talk, Maria. And thank you, everyone.
Thank you so much, Dr. Kutab. That was like really helpful. And I know we are getting a lot of questions, and we are going to address all of those once our panelists are done discussing their topics. So our last panelist is Dr. Amir Ehsan, and he is a Dow Medical College graduate and former Dogana president. He is board certified in hemopathology and molecular genetics. Dr. Ehsan is the founder and CEO of CorePath Laboratories, a nationally reputable cancer diagnostic facility in San Antonio, Texas. So, Dr. Hassan, question for you is, what is a good and what is a bad candidate for these pathways, and what are the red flags? What should be the next step for somebody who is looking for these pathways?
Assalamu alaikum, and thank you, Dr. Maria, for organizing such an important webinar. And I really appreciate the dedication and commitment of APPNA and all the esteemed members here. Before I start, I would like to, on the behalf of the panelists, want to have a disclaimer that this is only informational only. We are not giving any legal advice, and that need to be routed through regular channels. Also, I see the collective wisdom here. All people who are as a panelist have more than 100 years of collective wisdom. So this is a great resource thank you for putting this together. IMGs are cream of the crop. We know that. Whoever is going to be coming to the US are going to be the best from where they're coming. When I was going through this webinar, I clearly see there is a residency track and a non-residency track we are talking about. And whatever route we take, there are four components to it. One is your academic background, the experience that you have, the visa challenges that we go through, and are you a right fit for the job? And that's something that I'll be talking about, in this session. So what does a residency teaches us? Residency teaches us to becoming academically strong, to really have more hands-on experience in the US healthcare, and to be a culturally fit. And that's something that, it will be very challenging for this pathway to understand if you're not being trained in the United States. So I just want to give that kind of heads up to the participants. This aspect is one of the things which is often neglected, and you end up achieving all these goals and come to United States, and you feel like an identity lost, right? All of us have gone through this phase, and this is something that I'll be briefly talking right now. So, what is a stronger IMG candidate? If I'm looking from the employer side, definitely some of the key things are readiness to adapt to local culture, keeping your root values of the home country. Don't bring them back home in United States. Just be ready to adopt and adapt with the local culture. Um, Clear specialty alignment. Most of the discussion has been, of course, towards the primary care. So don't come up with expectation that you are a plastic surgeon or a urologist or surgeon and you'll be getting the same job opportunity here. So be very realistic and have a very clear, specialty alignment. You need to have in your resume a meaningful journey and improved trajectory that tells you like what you have done and what are the right things that you have done in the past. Willingness to train, of course, you'll be learning and you'll be in the job as well, but willing to adapt to the geographical needs and whatever job that you'll be looking for. And long-term commitment to US practice. It's not like I'll be going there for 2, 3 years and then go back home. It's really a long-term commitment to rural health and creating a family there. And understand this is a process, not a shortcut. For some reason, IMG have a culture of having a shortcut, but this is going to be a long journey and it's a process. Some of the aspects of the weaker candidate is chasing specialty without really clear objective criteria. Multiple failed attempts without reassessment, why the USMLE one was failed and things like that. Non-US clinical exposure or mentorship. Whether you are coming here, it's always better to have some sort of US experience as an observer, elective, or something, because you are getting into the healthcare system here. And another weakness is relying a lot on paid consultants instead of verified guidance, like here. This is a great forum. And as Dr. Rafia was saying, that don't have unrealistic timeline and expectation. It's going to be a journey. It's going to be a process, and you'll be experiencing this while you are here. One of the key message from stronger versus weaker candidate is desire alone does not equal competitiveness. Strategy does. So you need to really have a strong strategy. Some of the red flags that you asked me to address is what are the right ingredients in getting into the US healthcare system is, of course, taking the exams, the US experience if possible, and strong letter of recommendation. And are you a fit into the US healthcare system? If I would like to list the red flags, those are don't come with like a guaranteed job claims that someone is claiming the right job guaranteed. Carefully evaluate and discuss with your colleagues. Paid rotations or non-teaching or evaluation, if you would like to have a US experience, is not the good thing. You really need to look at the background of these opportunity for having US experience on observership. Anyone promising shortcut is not the right thing. Carefully assess that. Don't overshow your success stories on social media without transparency and verification. Overemphasis on the step scores is a good thing, but the right fit in the job is the key thing here. So there are no hacks, only informed decisions which are important. If I'm a candidate, I would like to evaluate what are my weakest link right now. So my weakest link is how has been my exam performance, my US clinical exposure, my letter of recommendation. And in US, as we all know, the letter of recommendation are a very personal letter of recommendation. It's not like a very generic letter of recommendation, which is issued by the principal office or by anyone. It need to be talking about you as a person and in your fit into the job. Come up with a specialty realism. What are we needing here and what is expected? And of course, we already talked about the visa clarity. So the progress and the strategy beats the panic. It's all about the economical scale of the US market, which changes every 10 years, as we know. It's all about supply and demand. I think it's a good opportunity, except some visa challenges. Once you have a good knowledge through this webinar, there's going to be a good, message going through. So don't get depressed, too many regulation stuff. I think there's definitely an opportunity here. So my advice is a few things. Get the honest mentorship and get that very early. Choose the specialty which is, of course, needed here in United States. Geography should matter, but make sure if we are talking about rural healthcare and you're flexible in doing that. And stop comparing yourself to others' journey. This is what we talk about. This happened to other person. Just look at the system. Just talk to many people, and have a good strategy. It's not going to happen in a week or two. It's a several weeks to several months of journey. We all believe that a U.S. System rewards preparation and not desperation. So planning is really the key thing, and networking and access to the resources that we are just talking about. So thank you, Dr. Maria. Back to you.
Yeah, thank you so much. That was really helpful. So we are done with our topics. Thank you to all of the panelists who have given their pearls of wisdom. We have a lot of questions, and then we are going to go ahead to our question and answer a part of the webinar. So I actually have compiled a few questions. For example, some of the people have asked that what are the specialties in which these pathways imply? Like, for example, if you have practice as a surgeon, or you have you have done clinical radiology back home, or you were an OBGYN. So can you come here and practice that over here?
So
I think this has been answered. Oh, sorry, Dr. Sohail Rao, please.
No, go ahead, Dr. Khan. I will add something from Texas viewpoint.
Okay, so as I think many of us has mentioned, so it is primarily for family medicine, internal medicine, and psychiatry. I think Dr. Kutta mentioned as well. So it would almost be, I would say, not like 100% impossible to serve any other specialty, but these primary care specialty would be mostly internal medicine, family medicine, maybe pediatrics, and psychiatry in some cases.
Yes, and I just to add what Dr. Khan said, he is right. In Texas Medical Board, I actually debated this particular issue, and one of the things that they have said is any specialty which is outside the primary care, and they have taken out OBGYN, and even psychiatry in certain is very limited. So it's going to be internal medicine, family medicine, geriatrics, and in some cases psychiatry, but it's actually not one which they are favoring. Any specialty that is interventional, that requires any intervention, is not going to be allowed under this. For example, OBGYN, orthopedics, and you name it.
Maria, can I add?
Yes.
So I agree with Dr. Ahmed Rehan and Dr. Sohail. And if you are working as a surgeon or any other specialty, you cannot participate in this program. You have to be working at least 1 year in last 3 years in these allowed specialties. So you have to be either pediatrician or primary care hospitalist, whatever internal medicine subspecialties are. You should be working in your own country in the same capacity for at least 1 year in last 3 years.
And
Dr. Kutta?
the Texas Medical Board has actually made it a little more restrictive. They want you to be working for at least 2 years in the last 4 years in your area of discipline. So every state may have a slight differences, but it's more or less the same.
Okay, gotcha. Dr. Rafia, you have raised your hand.
Yes. So I will support that too in Massachusetts also. It's more like, in the underserved area, the primary care solely, and some of that, component of the behavioral medicine and psychiatric side. And otherwise, no other subspecialties, have been supported.
Okay, thank you. A lot of people have asked that they have done FCPS and MCPS and back in 2017. And is there like a limit to that, like how old it should be? As you mentioned, like in Dr. Rao has mentioned, it's 4 years. I just wanted to clarify that. And is there a cap to old graduation? So if the person is like an old graduate, is there a cap to that? Is there a cutoff limit? We cannot hear you, Dr. Kutab. You're muted.
Oh, thank you. Thank you. Yes, I was able to, kind of explore a little bit more on this side too. It's mostly, they are preferring the people, graduates who are within the last 5 years, and they have 1 to 3 years of experience, and, and good standing in their own country, with their license and stuff. So I think it's a cutoff is like 5 years, if I'm not wrong. I don't want to convey something wrong.
So may I just add what Dr. Rafia has just said? In Texas Medical Board, when they were actually discussing this particular topic, FCPS and MCPS is when you got your fellowship or your is not important. What is important is the practice period before you apply. So you could have an FCPS in 2017 and you have been continuing to practice since then, and you apply, that's actually acceptable. So your post-graduation certification in Pakistan is not the important criteria. It's the practice prior to application to Texas Medical Board.
Exactly.
So people have asked that what kind of work experience you're looking for in your home country? Is it like house job, or is there any particular like criteria to gauge like how you are going to do an equivalency of that? You work as a medical officer, so at a tertiary care hospital. So how is that like measured?
So Maria, it's like, residency. Yes, that, that traditional in Pakistan, when we graduate, we go to the residency. So some residencies are 1 year, some residencies are 2 years. But altogether, if you have completed a residency and if you have been working there in a clinical, site, or getting clinical experience for next 2 3 years, regardless of like you are doing, primary care, or you are doing OB, or you are doing internal medicine or surgical, but you have to have after your residency until next 5 years, if you continue working as a clinical, provider there and in a good standing, that's what the requirement is.
So does it have to be internal medicine, or you can still be like an OBGYN practicing there, and then you can come up here and you can practice internal medicine?
No, you have to be practicing in your area of discipline in Pakistan. And we need to be very clear about this. And I can only speak on behalf of Texas Medical Board because I have that experience. Your residency after you graduate is 1 year in most institutions. And in most institutions, you do 6 months of one and 6 months of another. So please do not think that your entire 1 year, and let us say, I'm just making it up, that your first year was in internal medicine and your second 6 months was, let us say, in orthopedics. So your 6 months in orthopedics cannot be counted towards the requirement of at least 3 years equivalency of a medical experience in your discipline of choice. So it's only going to be that 6 months. And you asked a question, where should you practice? If you practice in an academic environment, in a tertiary hospital, remember, Texas Medical Board would be reviewing your application. And what they will be asking themselves is going to be people like you and other valued members of the colleague. They will be looking at it and seeing, did they practice as a private physician, or did they practice in a tertiary environment? Now, what would be your response? I rest.
Yes, and you nailed it, because the thing is this. I am, seeing like, me being as a primary care. Okay. So we cover like, internal medicine, we cover OB, we cover ortho, we cover everything. And in the rural area, you need to cover all this more like than other people. Okay. So if suppose, as you said, that 1 year you did this and then next 6 months you did ortho, I think it will be still kind of you are building a resume, but you said it that either you were working privately or you were working in a hospital setting or something. That is totally, I think, very, very important that I don't know that to say that the private would be lower kind of, um, clinical experience, what they are looking over here, the credibility of it as compared to the tertiary hospitals.
Yeah.
Right. Thank- So, other question is, how are we going to find out these employers, and how are we going to find, is there a resource, is there a website where you can look out for these employers or these hospitals and also these HPS areas, how are we going to find those?
Maria, mostly whatever right now the pathways are, and I can be wrong, and I can ask other speakers here. It's mostly like a federally funded community centers, community hospitals. Those are the target, like, that they will be the employers. And mostly the states where it's more like, we don't want to say, so, Medicaid states and stuff, but mostly the focus is on that.
So as I said, Dr. Maria, that we need APPNA and Dogana need to actually curate a list of Pakistani physicians in United States who are working in approved sites, and not that provide that list to the applicants, but create a portal where applicants actually put in their resume or put in or answer all the questions. We should also create a questionnaire on the website, on this portal. And once they complete that questionnaire and they are qualified, then they are actually paired with a potential supervisor. I think we need to actually facilitate this.
It's a very good idea, Dr. Rao, very good idea.
Otherwise, Dr. Khan is not going to go anywhere. We're going to keep on talking about it, and our physicians in Pakistan will keep on going through circles.
I think Dr. Fateh has hand raised.
Yes, Dr. Fateh.
Yeah, Dr. Sohail Rao, it's a good suggestion. We're already working on it with the APPNA chapters in each state, and we're trying to find out the potential employer. There is some issue, I don't know if I should say ethical issue, but we will work it out about charging recruitment fee, whether APPNA can charge or no, but at least we can provide a platform. But in my personal opinion, APPNA can even charge from the employer recruitment fee for providing them. So we're working on it, and your suggestion is very well taken, and we're already working on it from APPNA standpoint. And we should have this. Also, there are some recruitment agency. I know when Mr. Patel has it for Indian graduates. I've been in talk with him. So we'll bring him also sometime on the board. There are other recruitment agency they're working. They have established all the infrastructure, attorneys. They're very well versed and very effective. So there are platform available. We will share with the potential applicants. Also, we're working through the ambassador program in various medical colleges, institute in Pakistan, that to identify those applicants, that those have 2-3 years of experience in their specialty, if they have willingness to come. Third thing is there are many spouses of Pakistani doctors who are already here on green card or other visas that they could not match, or they have crossed the eligibility of matching. So we're working on that basis, the pool inside the USA. So it's all is in works, inshallah.
Dr. Fateh, I would strongly suggest that we actually create a portal on our website, either Dogana or APPNA, which actually also screens the candidates.
Yes.
Before you match them.
Yeah.
Okay, that will actually be very helpful. Otherwise, we will create a chaos for ourselves.
Yes. No, it will be on APPNA platform, because when we go on alumni, then it becomes a little bit harder to organize things.
Yes.
Dr. Maria, if I may.
Dr. Ehsan? Yep.
Yeah, so I just want to have a very different perspective here. we all are very much familiar with the AI tools that we are using in our industry, different places. So recently, I happen to have, there are a lot of clinical lab scientist programs. These are medical technologists which are needed everywhere in the country. And there are candidates coming from Philippines, from Pakistan, from India, from other places. This is going to be an enormous human need here. So there are tools available where you can find the opportunities through the OpenAI. And I just did like yesterday. And then you dump in the CV with these tools, and they can internally match which applicants are going to be applicable where. So I think APPNA, through its resources, there are a lot of smart people in APPNA from the IT perspective. Definitely utilize the AI tools for these kind of matching.
Great.
Okay. Dr. Khuta.
Maria, as Dr. Fateh said that there could be like a fee and stuff. So that I have a little bit of in that way. APPNA, I don't know what is the policies on the profit or non-profit kind of organization in that way that we can charge them or not. Dr. Fateh knows more about it. A component into that, there will be more liability involved in that way, that if we are charging them and telling them things, and then next day the policy change or something happen, or that employer say, no, I'm not taking internationally trained physicians, that will bring a kind of like, I don't want to say like a resentment or like a escalate the kind of emotions there in that way. Our solely kind of, if we can just make a registry or something, a national registry, that these are for the way how we do it for the eras, like, IMG friendly institutes, the residency program. That's the same way we can do a registry that, where the pathways, these employers and, so independently, these doctors, the IMTs, they go there and they can find out, that registry. I think that will be very helpful.
Yes, Dr.
That was
Rafia, what I was suggesting, again, this is all suggestion, we're looking into legals, that charging the employer, not the employee. Most of recruitment companies charge 50,000 to 100,000 per physician. So we can negotiate if we have a bigger pool. Again, these are a lot of things to be discussed with the council, and our non-for-profit are going through APPNA Foundation. There are a lot of possibilities. Are having a recruiter. Even some recruiter are charging both sides, employer and employee. Employee, they're charging on a yearly basis. You pay 5,000 every year for 5 years or something like that. So if you're employed, so those are various different models. We have not decided that. I'm not the person to decide. I'm just advising, giving suggestions. We will discuss with the president as well as with BOD, council, and other people before anything is implemented. These are just suggestions.
Thank you,
so.
Dr.
Thank you so
Fateh. And
much.
also, give me 1 second.
Yeah, go ahead.
I didn't want to step on you. Sorry about
No
that.
worries.
The only thing I feel as an advocate on our international, they are already going through so much, the financial aspects, things like that. People are just taking money from them and this is like something so much on them, and there are no much kind of opportunities there. So that's why I said that, I felt like, taking money from them is like,
Once again, it is hopefully it will be from the employer, not employee.
Okay, thank you.
Thank you so much. I will move on from this question. We are going to, APPNA is actually working actively in making a model or like some kind of a resource. And hopefully once we have more information, because this is so new, even for us, once we have that, we will go ahead and publish it. Please feel free to email us as well at ypc@appna.org. But we will be updating you as soon as we have more information on this. I have few more questions before we go ahead and conclude our webinar. Somebody asked, like, if Caribbean medical graduates, do they qualify for this pathway? And also, if somebody who has done fellowship in the US but not residency, do they qualify for that? So, Dr. Ehsan.
I think as long as you fulfill the criteria that was discussed by the panelist, having any US experience in the relevant specialty or the field is going to be very relevant and make them very marketable. Most of the Caribbean physicians that I have experienced are already US citizen or green card holder, and they have some experience for US electives and stuff. I think there's going to be a good opportunity for these kind of graduates as well.
I will quickly add one thing. So for fellowship, I think if some states are very strict about the years of training, usually fellowships are 2 years. So if in that case they could consider doing like an additional year of fellowship, like if they are doing nephrology, maybe doing like 1 year of sleep, so that they meet that cutoff of 3 years. Because some states would be strict, but in some states like New York, they won't be strict about the number of years they have had training.
I would like to add, Maria.
Yep.
So again, it becomes that the specialty which are allowed. So if you've done cardiology or any other fellowship, that's not going to be helpful. So you have to be practicing in last 3 or 4 year, 2 year in the same specialty you're applying for. So that's important. Other thing we need to consider is that it's not only the state licensing authority that's going to make decision. It's going to be your employer regarding your age or experience. Where did you work, tertiary or primary care? So they will look at your resume too. So you have to have employer first before you can do anything. So all these factors will be considered: your employer, your eligibility for workability, green card, citizenship, being present in USA, your age, where did you work, and what specialty you worked in last 3-4 years. So these are all factors included.
So,
And
Maria,
also,
Dr. Afia.
very important is that area is in need of the physicians. That is very, very important. Like if you are applying to like a very hi-fi kind of institute, and they are not in the category of the underserved, it is not going to happen. So we have to be realistic about this. Like some people say, oh, just like, okay, so we will be working in a gaon, in a village. And I said, that's where they are looking for. So you have to, if they are bending down, they are trying to be flexible and, waiving this requirement, then you have to come down to this too. And even for the Caribbeans, they also need to be in the same field. It's not that if they have done a fellowship somewhere and now they are looking for the same thing over here, it's not going to happen. They are very rigid about it.
Yep. Thank you so much. So I am going to go ahead and take one last question. There's somebody actually has asked if there is like an age limit to this pathway. Is there any age limit to this?
As I mentioned earlier, this will be decided by your employer. He's not going to employ a 65-year-old. I'm going to tell you that. So maybe there's no age limit from the state board, but there will be age limit on your employer side.
And also the experience, like how recent you are, that is very important.
Okay.
Like if you did not work, like you are 62 years old, but you did not work for last 10 years, it's not going to happen.
Maria, can I add something to your last question?
Yes.
You asked a question about fellowships. I can tell you that in Texas, you are not allowed to do fellowships in this particular program, even though you may have a full licensure, because it's an ACGME requirement that you must be have a ACGME approved residency in the area of specialization to go into fellowships. It is not a state requirement. It's not a federal requirement. So anyone who is talking about fellowships, doing fellowships after getting a full license, they need to think again. That's not going to happen.
No, I think what they were asking was that if somebody has done fellowship already, because there are many ID, rheumatology, nephrology fellowship you can get without residency. I think that was the question in that contest.
Oh, okay.
And I can add, I think we have also done probably a webinar on that. So that's, in old days, they used to call it a post-fellowship match. So that's basically if you are ECFMG certified, and same thing, you have some experience in your own country, ideally internal medicine 3-year residency. You don't need to have passed those FCPS, but 3 years of training. You are eligible to apply for those vacant fellowship spots. Nephrology, infectious disease, these are like geriatric medicine, even sometime addiction medicine. These are like the most common ones. And the same thing happens in psychiatry as well. So then a lot of time those people would back because they are sponsored visa. ECFMG will sponsor them J1. And then a lot of time those people will backtrack and apply to residency after they have done fellowship.
So, Dr. Khan, can we clarify this for our audience here? People who have gone through this alternative medical licensure pathway and get full license, can they apply for fellowships?
In my personal opinion, I think I'm not sure. Honestly, I don't know, because I think the problem is that for fellowship, so they can apply from that standpoint if they have done like training in their own country, like they have done training in their own country. From that standpoint, they will qualify. But I'm not sure if working as a house physician or working under this pathway will make them eligible to apply for fellowship. That I don't know. But because most of them would have already done fellowship, adequate training in their home country, they would be able to apply from that standpoint.
Dr.
Yes,
Suhail,
because
it will be in the same capacity like resident like Pakistani applicant who are ECFMG certified. They are getting into fellowship, so they will go through the same pathway. If the program offers them fellowship, they're ECFMG certified. They've done their steps, and if they want to do fellowship after this program, I think they'll be eligible.
Okay.
So,
So thank you
Dr.
so much. I'm going to go ahead. So I'll have Dr. Rao, and then we will go ahead and wrap up the webinar. You go ahead.
Dr. Zafran, who's the executive director for Texas Medical Board, in his webinar, a similar question was asked, and he said, in Texas, you cannot. That if you have a full licensure, you cannot. You can go for a board specialty. You can apply for ABM, American Board of Medical Specialty, and get certified, but you cannot go into a fellowship. I just wanted to clarify that.
So yes, so thank you so much, everybody, for attending. I really appreciate all of the panelists who have taken the time to go over all these questions as well as their topics. I also thank all the attendees who have attended our webinar. Our webinar is being recorded, so as soon as we are done with this, we are going to go ahead and put in the link for the recorded session. If you have any questions, please feel free to email us at ypc@appna.org. You can also email APPNE, APPNEY 1947 @gmail.com. And like I said, we are still in the works of collecting data and coming up with a process. But as soon as we have more information, we'll be able to post more information and resources for you. Any last takeaway point from our panelists? I will go one by one. Dr. Fateh Shahzad.
Yes, thank you again. It was very informative. I learned a lot. So only thing I will talk about the challenges. On one side, the states and country want more physicians to come and join healthcare. At the same time, we're putting restriction on their eligibility, like H1. Right now, H1, as I mentioned earlier, is 100,000 fee per paid by employer. Some exceptions, but still, if you're outside country, you have to have $100,000, and some employer may pay, may not pay. And then Texas is even putting a freeze even in that process, because you need state help to get H1 process, like labor certification and the state licensure, which is under the governor powers. So that will be restricting us. Then the EB1 visa, which is immigrant visa, that's also on freeze in 75 countries. Pakistan is one of them. So even if you do EB1 visa from Pakistan and other 75 countries, you will not have the consular processing from Pakistan or your home country. It can be done within USA, but it cannot be done. So there are very many limitations. So that's why we're working with the AMA, AHA, as well as other Pakistani APPNE and other organization. Dr. Babar Roy is not here, but we're working on that, having a joint force we provide 25% of IMGs, these four countries, then we should work with them and say, here you want more doctors, opening up alternate pathways, but then you're not giving visas. So that will be hopefully discussed and brought up soon with the Congress, with the White House, as well as with local congressmen through our chapters.
Through the liaison.
Yes. So Dr.
With
Kutta.
other professional organization. So one thing, Maria, I want to say into this is that for all the students, for all the ITPs, please do not fall into the deception of like people, they are charging you, there are companies, they are, in offices there and lawyers and reaching out, and even from America that, we're gonna get you the position and you pay this much. So I will, please guys, whoever is watching, be mindful, putting your money there for the reasons that you're gonna get it. First, you need to know the whole process. You need to know the complete truth of it. And you need to know that when you are giving this money, that this person is legit or this company is legit or not. This is very, very important. That I went to Pakistan last month and it was literally heartbreaking. People were telling this much money they gave to this agent or this agent. Please, guys, do not do that. Go to the legit site, go to the legit people, and then you know what, put your money there if it is needed. But you need to go
Agree.
through a proper channel.
Agree.
Yeah, very good
Any other
point
thoughts?
by Dr. Kutab. Very good point. I will also wrap up by saying a few things. I think let's stick to the basics. If you are able to do USMLE, please do that. Of course, the common pathway to apply for residency would be the most, uh, shouldn't say easy, but the most common one. What I would also, a lot of people ask me if we are unable to match. I would say that if you can also take FCPS Part 1 and try to start residency training in Pakistan, that not only helps you to get eligible for these pathways, but it also helps you actually in residency. A lot of program directors we have talked to, they love when you are doing training, structured training in your country.
Yeah.
So again, please don't fall into the trap like people would make those attractive thumbnails, work in US without USMLE. Anything can happen, but I think that I'm 99% sure that without USMLE, it would be highly unlikely that you would be able to work as a physician, practicing physician in US. So please keep that in mind. Thank you.
And
And do
institute
the house
needs to be
job, do the
involved.
house job, do the house job. People are eliminating house job. Do the house job and get PMDC license. I
Absolutely.
don't know how to enforce. People
Absolutely.
are,
And
yeah.
an institutes needs to be involved in these pathways. They do a career counseling. They need to talk to their ITPs. They need to talk to their physician. There should be something, like a counseling and all that stuff too. And then they can counsel over here. There should be some kind of bridge there.
Yeah, but
Dr. Dr. Rao and Dr. Ehsan, any last thought?
Well, first of all, Maria, thank you for putting this together. And for the valuable panelists who were here, I'm sure the students must have, and the physicians in Pakistan must have gained a lot. I think my concern is that Dr. Rafia just mentioned that the institutions should get involved in creating these pathways. When you talk to institutions such as FCPS and others in Pakistan, they feel that this is a brain drain. You're
Yes.
actually promoting the export of Pakistani physicians, the top level Pakistani physicians outside the country. So why should we actually participate with you? And that is their thinking at the present time. I can tell you for sure if somebody in that particular organization is listening, that is what they're thinking. They are not supporting us.
Yes.
And
I
I
totally
think
support you, Dr. Shadad.
So-
Totally. I went through it. I went through it.
so.
Dr.
Again, thank you very much. Go ahead, Dr. Hassan.
So again, lastly, Dr. Maria, thank you for putting this together. Two things. One is a hope, and other is a suggestion and advice. The hope is look at the economics of healthcare in the United States. Not that many medical schools are being formed. Residency programs are not being increasing, and the patient population is aging. So there's a huge gap between the demand and the supply, and the dynamics of the visa change it very quickly in the United States. I remember like when we came for the residency, we got the visa only on one day, like at USMLE 1, and we received the results in United States. So don't be discouraged. I think there's going to be opportunity opening. So that's my hope to all IMGs out there. My advice, and this is based on our personal experiences,
I think he
others
froze.
or chasing prestige.
Now we
It's
can hear you.
honest self-assessment, correct sequence of the events, avoiding costly misinformation and mistakes. IMGs who succeed are not always the smartest or the highest scoring, but the ones who make the strategic, well-timed decision, fix their weaknesses ahead of time. Thank you.
That was very insightful. Thank you so much. It was really helpful, and it was a great, actually, a source